Hi, class. So, when we first started this class, I truly did not know what nursing theory meant. I didn't understand how it correlated to nursing. I didn't see how it applied to everyday interactions with my patients or dealing with family members. But by the end of the semester, I was able to see how it all correlates. Um, how I how it correlates to when I'm dealing with patients, how these theories are actually ingrained in my patient care, and the way I communicate with families when I create care plans. And to me, nursing is about taking care of the whole person and not just the diagnosis. Every patient is different, so there isn't one approach that works for everyone. We have to be flexible, and being a great nurse, an excellent nurse, we have to be flexible. We have to advocate. We have to listen. We have to educate. We have to create care plans that fit our patients' needs. And one theory that really stood out to me, and it was actually the theory I used for my project, was Ramona's theory. And even though it focuses on mothers, the idea of supporting people as they adjust to major life changes can apply to so many patients. Because think about it, we're dealing with patients that are like status post motor vehicle accident, that, afterwards they have a lot of trauma, right? We're dealing with patients, diabetics, who had bilateral amputations. These are all major life changes for people, or someone that was just recently diagnosed with cancer or Parkinson's disease, etc. Another influence is Patricia Bennert's when she talks about the novice to the expert theory. And, it reminds me that learning doesn't stop after nursing school, right? Like, think about it. You completed your 3-year program, you completed your 4-year program. When you graduated, got your first job, you were on that floor and you felt like you didn't know anything. Like, learning never stops. I'm constantly learning, you're constantly learning, and that's the beauty of it. And it becomes a problem when you stop allowing yourself to learn. And every patient and every experience that we have helps us grow and become more confident within our field. And then we talk about Maslow's hierarchy of needs, which actually, when we did the icebreaker, I didn't even realize. I actually talked about this in my discussion post, and I didn't even realize it was like a theory. But pretty much it talks about how in order for a patient to get well, or anyone to get well, they need to meet the basic requirements, right? Like, we talk about, they need to be their basic physical and emotional needs have to be met, in order for us to see positive outcomes. And as my journey as a psychiatric mental health nurse, I want to use the theories that I've learned in this course, the ideas, the framework, within my practice, because I want my patients to be heard. I want my patients to be respected. I want my patients to be involved in their overall treatment. So this course has really taught me a lot, and I'm actually very, very thankful, and I feel like it really opened my eyes. So, yes. All right. Thank you.